हूँ।
अरे वो वीडियो बंद हो
आज
गया। Good evening, everyone. On behalf of Nash 24/7, I welcome you to our public awareness program on how to win over fatty liver. Nash 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, we have a renowned gastroenterologist from Delhi, Dr. Rajeev Shandil. He needs no introduction. However, I would fail my duty if I don't mention that. Dr. Rajiv is the leading gastro in Delhi, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with Apollo Hospitals, Indraprasth, New Delhi as a senior consultant gastroenterologist and hepatologist. Sir, we salute your dedication towards spreading awareness related to liver health. So now I invite Dr. Rajiv to enlighten us on the topic. Over to you, sir. Sir, yeah, please unmute yourself.
Second.
Please continue,
Yes,
sir.
thank you.
Can you hear me?
Yeah, yes, sir.
Okay. Good evening, everyone. Can you hear me now? Hello?
Yes, sir. Yes,
Yeah.
sir. You are audible.
I'll continue. Okay. Good evening, everyone. Then thanks for sparing your time on this Friday, almost night. And we shall be talking about a very common disease, which is known as MASLD now. Used to be non-alcoholic fatty liver disease, but for some purposes, that is to remove the stigma out of the disease, because it had the word alcohol and also fat in it. So they removed the word alcohol and replaced with metabolism associated. So because it has problems in the metabolism of a person, and also the fat, has been replaced by the word cetosis, which is the scientific word for fat. So now it is known as MSALD, but for old timers' sake, probably we are using the word still NAFLD. Name doesn't make the difference. The disease is remains the same, and we shall be talking about this disease and how it occurs and how it can and should be prevented. Because it has quite a high prevalence, especially in the urban setup. So first and foremost, when we talk about the liver, it is the second largest organ of human body. जो हमारा liver जिसको जिगर कहते हैं, that weighs about of almost 1.5 kgs, and it usually has about 0 or about 5% fat. इसकी location जो है, it is present on the, when you touch your tummy, abdomen, the upper hand side of the right side, that is the where it is present, upper right hand side of abdominal cavity, on top of the stomach and intestines. It is when you see the liver while operating, it is pinkish brown in color, a healthy liver. It has very soft consistency and has a lot of blood vessels in it, so it is highly vascular organ. जो उसके फंक्शन है, उसमें मुख्यतः 3 फंक्शन जो लिवर करता है। इसको एक तो ये है कि सबसे जरूरी है जो हमारी पाचन शक्ति है, उसको ये कंट्रोल करता है। दूसरा, खून जाना ज्यादा पतला हो ना ज्यादा गाढ़ा हो, और तीसरा, जो जितने भी गंदी चीजें हैं उसको वो साफ करता है। सो दैट मीन्स इट डिटॉक्सिफाइज द ब्लड, इट डिस्ट्रॉयज ओल्ड red blood cells which are responsible for our hemoglobin, और जितने न्यूट्रिएंट्स हैं या ब्रेकडाउन प्रोडक्ट्स हैं या मेटाबॉलिक प्रोसेस चलती हैं जो लगभग 500 के करीब जिसम में चलती हैं, उन सब का जो all the metabolic processes happen actually in the liver mostly, and it also regulates the composition of the blood. It also produces bile, which is stored in the gallbladder, and it is the gallbladder contracts and throws the bile in the intestine when there is the stimulus for the food in the small intestine for its absorption. And it also produces the endogenous proteins and cholesterol. So most of the times, the proteins and cholesterol which are there, the endogenous proteins and cholesterol are actually produced by the liver. So that is why actually it is very important. All the functions are done by the liver. So when you talk about the non-alcoholic fatty liver disease, it's a condition in which fat makes up more than 5% of the weight of the liver, which is not caused by alcohol use. Or these people take very minimal fat. And this fat is stored within the cells of the liver, which are the hepatocytes, the liver cells. And if it is not treated properly, like whatever we need to do it, there is some amount of inflammation, यानी कि लिवर के अंदर सूजन हो जाती है, और जब सूजन हो जाती है उसके बाद उसमें स्टेटोहेपेटाइटिस वाली स्टेज आती है, और सूजन के बाद फाइब्रोसिस है, यानी कि लिवर कड़ा हो जाता है, और उसके बाद लिवर सिरोसिस की तरफ तब्दील हो जाता है। और किसी का वजन अगर ज्यादा हो, ओबेसिटी है, और या किसी को डायबिटीज है, कोलेस्ट्रॉल हाई है, तो दीज पीपल आर एसोसिएटेड विद इंक्रीज रिस्क ऑफ फैटी लिवर. सो what we are, in a way, we tell that almost 25% of the population has fatty liver. If we talk about urban males, like in Delhi, almost 55 to 60% may have fatty liver in the subpopulation. और अगर डायबिटिक्स की हम बात करें तो 10 में से 6 से 8 एक्चुअली हो सकता है कि डायबिटिक हो, और 9 बहुत ज्यादा जो ओबीस लोग होते हैं उनको भी फैटी लिवर होने के चांसेस होते हैं. और मेल जेंडर हैज बीन रिगार्डेड एज रिस्क फैक्टर फॉर प्रोग्रेशन टू, मतलब फैट से फाइब्रोसिस, और फाइब्रोसिस से आगे सिरोसिस होने के चांस होते हैं. सिरोसिस ऑफ लिवर इज a deadly condition. When it progresses, it can cause a lot of problems, complications, and hepatic cancer, and ultimately even death. So how it happens is that healthy liver में जब fat का deposit होता है, that is only fatty liver. That is it only causes fat, but there is no scar formation in the liver. So when the scar also gets formed after there is inflammation, there are fat in the liver cells. So when they interact with each other, there is some crosstalk between the cells. There are some certain byproducts which cause the fat to cause interaction with each other. That causes inflammation. सूजन होने के बाद वहाँ पे scar tissue बनता है. It causes progressive damage to the liver cells. That causes liver fibrosis. And ultimately, the scar tissue destroys the liver cells. completely and liver is unable to work properly, and that is when the stage of cirrhosis happens. That is, the person has, even the fibrosis to a large extent is irreversible, but cirrhosis is totally irreversible. And in this situation, you have to control the complications of cirrhosis rather than reverse the cirrhosis. So the difference is obvious. Fat accumulation is NAFL, or NASH is fat accumulation with inflammation and scarring. The causes obvious: obesity, normal से ज्यादा वेट होना, BMI की हम बात करते हैं, जैसे बॉडी मास इंडेक्स यानी केजी पर मीटर स्क्वायर, आपका सब आप आसानी से निकाल सकते हैं कि आपका वजन डिवाइडेड बाय योर हाइट इन मीटर, उसका स्क्वायर रूट अगर हम करते हैं तो वो 23 के आसपास होना चाहिए, 23 से नीचे इंडियंस में, और कॉकेशियन या वाइट पॉपुलेशन में 25 तक भी माना जाता है. अगर वो 23 से ज्यादा है तो यू आर ऑन द verge and you are at the risk of developing fatty liver disease. Even some people have genetic background. Certain foodstuffs will also cause fatty liver, and especially processed foods, foods rich in carbohydrates, and also fats. People who have metabolic syndrome, which can be diabetes, combination of diabetes, more cholesterol in their blood, blood pressure, obesity, and other lot of other things also. और कई दवाइयां भी ऐसी होती हैं जिसकी वजह से लिवर में फैट एक्यूमुलेशन ज्यादा होता है. एंड नीडलेस टू से, जिसमें अगर कोई काउच पोटैटो टाइप हो, जो लेटा रहता हो, ज्यादा एक्टिविटी ना करता हो, फिजिकल एक्टिविटी ना करता हो, तो जो खाता है वो पचा नहीं पाता, ओबेसिटी होती है, मेटाबॉलिक सिंड्रोम पे प्रीडिस्पोज्ड होते हैं, एंड दीज पीपल आल्सो कैन डेवलप फैटी लिवर. So being overweight causes fat to accumulate in the liver, and obesity increases the amount of fat to constitute more than 5 to 10%. This leads to NASH and scarring of the liver. So threefold increase in death because of cirrhosis, and they are sister diseases. Basically, diabetics have more fatty liver, and fatty liver people develop diabetes if they already don't have it. There's high prevalence of diabetes, almost fourfold risk of developing diabetes if somebody has fatty liver. So basically, diabetes develops from the liver. If your liver cells have fat in them, the food products are not, there is insulin resistance. The insulin that is produced by the pancreas, that finds it difficult to digest the fat or any food stuff that comes in the liver. And more insulin has to be produced by the pancreas. At some stage, when the pancreas is unable to meet the demands, the blood sugars rise in the body and the diabetes happens. So you have to consider in a way that the people who have fatty liver, and especially slightly advanced fatty liver, are at high risk of developing diabetes. So in the fatty liver patients, only fatty liver, they may have mild fatigue and some discomfort, या कुछ थोड़ा बहुत दर्द हो सकता है right side of upper abdomen में, but that is very minimal. That's not so strong that you will consult a doctor. But suppose a person has developed steatohepatitis and later on cirrhosis, then you have symptoms of cirrhosis, that people will have increased fatigue and nausea. Sometimes you don't know that you have cirrhosis. It's only on evaluation that you know that your cirrhosis has already happened. Or sometimes people do present with only complication, that they have a bloody vomiting, and then they come, or they start developing fluid accumulation, पानी भरता है पेट के अंदर, और तब पता लगता है कि ये तो सिरोसिस हो चुका है और उसकी कॉम्प्लिकेशन हो चुकी है. कई बार पेट के अंदर पानी भरने के बाद भी या उसके बगैर आदमी को कंफ्यूजन होने लगती है या बेहोशी आने लग जाती है. दैट इज नॉट एंसेफेलोपैथी. दैट इज आल्सो अ रिस्क फैक्टर, दैट इज आल्सो अ कॉम्प्लिकेशन ऑफ सिरोसिस ऑफ द लिवर. भूख कम होनी शुरू हो जाती है. पीपल स्टार्ट ब्लीडिंग इजीली. दे हैव स्वेलिंग इन द फीट आल्सो. Sometimes there is unexplained weight loss. Sometimes jaundice can also happen. That is slightly more advanced disease. And you have the veins which are dilated at the lower end of esophagus. Food pipe के नीचे veins हो जाती हैं because of the pressure, back pressure from the liver to the veins. And these can rupture and cause bleeding from your mouth. And sometimes you can have dark colored stools. So it's a silent killer, because the progression of the disease is very gradual. Diagnosis often involves certain blood tests, an ultrasound, and a fibroscan, which is like a ultrasound, but it gives you the exact value of the fat. And if some early fibrosis or cirrhosis has already happened. Liver biopsy used to be used earlier very commonly, but these days we don't resort to liver biopsy only for the diagnosis. And X-ray, CT, and MRI are also, X-ray especially not, but CT and MRI are also helpful in diagnosing fatty liver disease. The most common disease is ALT, alanine aminotransferase, or SGPT, which is also known as. This can tell us about when it is raised. It can be known that there is some amount of सूजन जो है liver में चल रही है, inflammation is happening in the liver, and then you can test for the presence of fatty liver. Patients with normal ALT can also have progressive disease sometimes because they can be fluctuating at times, and you may not actually know that you have fatty liver. So if at some point of time you have normal ALT levels, you may feel that you don't have fatty liver, but that doesn't mean that there is no progression of the fatty liver. So serial ALTs over a period of maybe months to years will actually tell you if your fatty liver is increasing or not. There is no designated cutoff for prediction of NASH or advanced fibrosis in these patients or people, that is normal people. But yes, other tests you tell you about the progression of the disease. There are certain scoring system like FIB4 and NAFS, NAFLD fibrosis score, but these scoring methods have been established to diagnose more better than only the blood test. So combination of blood tests are used, and they are fed into a formula, which it is present in a lot of apps, and you just put your values, that is the blood test values, and they can tell you with quite a degree of certainty the amount of fat and the amount of damage if it has already occurred. There is another entity known as MRI-PDFF. First is the ultrasound, actually. Ultrasound is easily available. It is economical and reason for the most accidental diagnosis of fatty liver. When we get disease, ultrasound for any other thing like pain abdomen, and you find that your liver is quite fat, there is a lot of deposition in the liver, and you may also have cirrhosis, like in the right-hand side picture. But it detects NAFLD or fatty liver disease if the fat is more than 25%. But it cannot differentiate between fat or if the fat has already caused some fibrosis of the liver. Then there is the fibroscan, which is quite commonly used, and it has two things. One is CAP, the other is the LSM. CAP is nothing but the amount of fat. So it can diagnose this fatty liver when the fat is almost even 10%. And it can differentiate between fat and fibrosis also. It is easy to operate, but it can be misinterpreted in some obese people. You can have wrong values. So if the cap is about 240, you have normal. Up to 290, the value you may have almost 70% of fat in the liver. And as far as जो KPA, यानी कि liver stiffness measurement, that is known as LSM, is concerned, up to 6.5 is taken as normal. The picture is showing 5.2. That means the person has normal fibrosis. There's no fibrosis. There is no fat here. 1 in 98 is perfectly normal. And if you have more than 6.5, some amount of fibrosis is happening to the liver. More than about 13.5 to 14 is taken as that patient has already developed cirrhosis. So this was which we are talking about, the liver stiffness measurement, and CAP, the control attenuation parameter, which indicates the degree of fat in the liver, that is steatosis. Then another thing known as the MRI-PDFF, much more sensitive. It's a gold standard to detect fat content, especially in people who have to donate liver donors, in which you want to the T. Almost 1% fat can be detected, so that you are more precise in finding the amount of fat in a liver in a person. It is a widely used technique for liver donors. So it's not widely available, and it's costly also. So it's used very seldom, but when in special cases, it is used. Liver biopsy has been the gold standard for ages now, and is the only method to diagnose NASH and to rule out other diseases. But it's painful, and an individual has some side effects, and chances of misdiagnosis are also there in the early stages because it has some sample variability because of the risk, because it's invasive, and some amount of bleeding can at times happen, although it is quite safe. People may refrain from it, and over a period of time, only for the diagnosis of fatty liver, we are not doing liver biopsy regularly. So Progression takes years, so early intervention will be beneficial. Isolated fatty liver, none to very minimal progression of fibrosis, no increased risk of death compared with the general population. NAFLD में से 70%, 75% लोगों में जो होंगे, they will have only fatty liver with minimal inflammation, but about 20 to 25% will have some amount of inflammation happening, that is NASH. And all of those people, about 11% over 15 years will have developed cirrhosis. And the people who develop cirrhosis, out of them, over the next 10 years, about 20 to 40% will develop decompensation. That means complications like development of ascites, that is the fluid in the tummy. They may have bleeding, they may have confusion like encephalopathy we talked about, and sometimes some people may have hepatocellular cancer also. So there is the issue is not that the people will have liver disease, but the people who have excessive fat in the liver, they're also at increased risk of death compared with general population because of heart diseases, because of cancers and other liver-related problems. So NASH with fibrosis has worse prognosis. Fibrosis progression associated with more diabetes, severe insulin resistance, weight gain, rising AST and ALT at times. So you have to act before it's too late. Progression of NASH also increases your heart-related problem risk. This steatohepatitis is more serious form of NAFLD. So you have scarring of the liver and it leads to cirrhosis and cancer. Severe NASH, like when you have cirrhosis or cancer, it is not reversible at all. How is it treated? Basic thing is that you have to maintain a healthy weight. So for that, you have to exercise. Basic minimal exercise is about 30 to 40-minute walk, which should be done at a speed of maybe 1 kilometer per 10 minutes, and which should be done most days of the week. Your diet should be like a Mediterranean diet. It should have natural products, less of processed foods, more of proteins, less of carbohydrates, minimal fats. This is the mantra. And lifestyle modifications, like if you already have fatty liver, you're obese, then as it is, there is no amount of alcohol which can be termed as safe. And certain new medications, if they are needed, they have to be taken if absolutely contraindicated, or other precautions have to be taken along with that to जिससे कि जो liver का problem है उसका progression कम रहे. So you have to speak to your doctors about the treatment options, not only for the fatty liver, but certain other medicines which can have adverse effect on your already existing fatty liver or advanced cirrhosis. So control your weight gain. It has to be a combination of hypocaloric diet and moderate intensity exercise, which provides best likelihood of sustained weight loss. Weight loss of at least 5% helps to improve the fat. But if some steatohepatitis is already there, like FibroScan maybe in the range of 7 to 8, then the weight loss has to be more than 10%. And then you will have some reversal of fibrosis, which can happen in select subgroup of patients. So you have to understand that weight loss of more than 3%, which will help in bland fat. And if there is some inflammation, या सूजन हो रही है, तो weight loss is about 5% which is required. And NASH resolution occurs only after 7% of weight loss. Fibrosis, almost 10%. Diet, we talked about. Weekly, you should have moderate portions of poultry, eggs, cheese, and yogurt, and less often red meat and sweets. Every day, you should have meal which should be based around vegetables, fruits, whole wheat grains, olive oil, beans, dale, nuts and seeds, herbs and spices may also be used. And often twice each week, fish and seafood may be taken, which is quite good for the liver. Every day, one has to be active, and 7 to 8 glasses of water should be consumed. Type of exercise, you have to consider, you have to understand that it's not only cardio exercises, which are important. Strength training is also important because as you age, especially over the age of 55 to 60, you start losing muscle mass very rapidly. And that is not good for your overall health and especially metabolic health of the liver. So aerobic exercise, they reduce the liver fat, maintain healthy weight, improve the cardiovascular conditioning. But the liver inflammation is reduced by resistance exercise, like weight training. It can be simple push-ups, it could be weight training, it could be anything which which puts strains on your muscles. But important is relaxation after doing these resistant training exercise. Improves the glucose absorption with insulin sensitivity and improves the metabolic parameters with less energy consumption. Uh, so you develop an exercise routine, and the most important is to stick to it. It's not that you start today and stop it after maybe 3 to 4 weeks. It has to be a lifelong process. Get enough sleep, get enough vitamins and minerals. Should have regular medical checkups if you already have a disease. Otherwise, also once in a year or once in 2 years, you should have regular medical checkups. Eat small, frequent meals, hypocaloric diets, and lower your sugar intake so that even if you don't have it, you don't develop it. So pharmacological approach as far as concerned, and that is the drug approach this is for the doctors to decide. 3 molecules have been by the Indian Association of Liver Diseases, which is only 3 drugs. There is another drug which has come about only in the last couple of months, but that has not come to Indian shores as yet. It may take a few months to years. Presently, we are using pioglitazone, saroglitazole, and vitamin E, and they are given for specific conditions, uh, looking at the patient profile and his blood tests as well as his weight. Tips we already have discussed now: limit intake of saturated fats and trans fats, eat a balanced diet, limit consumption of refined carbohydrates, maintain a healthy weight. We talked about the BMI, quit smoking, exercise regularly, limit or actually avoid alcohol, and take medicines only as prescribed. Polypharmacy is not recommended in a lot of people because a lot of diseases are there as you age, but the drugs should be kept to a minimum, and the drugs which are required for fatty liver disease, they should be uh, the option should be weighed against the side effects, and they have to be individualized. This is the era of personalized medicine. जिस आदमी को जो तकलीफ है उसके हिसाब से वो देना चाहिए. वन साइज डजंट फिट ऑल. मतलब एक दवाई, इसका मतलब ये नहीं है कि किसी को फैटी लिवर है उसको सिर्फ विटामिन ई काम आएगी या सारोग्लिटाजोल ही काम आएगी. जिस जिस आदमी का जितना वेट है, जो उसका मेटाबॉलिक प्रोफाइल है, जो उसके ब्लड टेस्ट है, उस हिसाब से वो दवाई देनी चाहिए. और वो दवाई जब तक दी जाती है तब तक लेनी चाहिए. अपने आप बंद करने का कोई मतलब नहीं है. और साथ में ये भी है कि अगर दवाई दी गई है, कोई दवाई, कई कई दवाइयां जो है वो लाइफ लॉन्ग चलती हैं, उन दवाइयों को तब तक लेना चाहिए. So this is the crux of our presentation today, and I think we have finished now, and I'll be happy to take any questions.
Yeah, thank you so much, sir, for this wonderful talk. This has enlightened us. Now, we would like to take question from the audience. So, can we do it with your permission, sir?
Yeah, definitely.
Yeah. So, sir, we have one question that is, does liver 52 have any role to play in NAFLD?
Liver 52 is an Ayurvedic preparation, and conversely, some people have also found that it has deleterious effect on the liver. It doesn't have any uh, good role to play in liver disease. For ages together, for decades together, we have been fed on this diet that Live 52, if we take, it is going to benefit our liver. There is absolutely no rationale and there is no proof. There are some people who come to us that I take Live 52 and then I take 2 or 3 pegs and it keeps my liver healthy. There's no truth in that, and we don't encourage the intake of Live 52 at all.
Right. Thank you so much, sir, for this insight. So the next question that we have is that how NASH is diagnosed, like when to visit a doctor.
Yeah, because NASH is asymptomatic. So there cannot be an answer to when to visit a doctor. NASH without complication will never give you any symptoms. It will only the complications which give you symptoms. So if you want to have a diagnosis before you develop complications, it has to be your health checkups, which these days are quite common, and yearly or maybe 2 yearly, your health checkups should be done, especially after the age of 40. Ideally, they should start almost even after 20, and certain people who have family history of certain diseases, they should start as early as possible. But after 40, a lot of companies are also sponsoring their employees to get health checkups done. But as it is, otherwise also people should get it. If all the things are in perfect order, you can increase the frequency of your tests. You can get it every 2 yearly or 3 yearly, but ideally speaking, every yearly you should get your tests done, and basic blood test and a basic ultrasound can give you a lot of information.
Thank you, sir. Another question that we have is on diet. That what is ideal diet recommendation? That which diet to follow?
So there is no particular diet which should be followed, because you see ours is a diverse country. As it is, the world is quite heterogeneous population the world has, and we have different dietary habits. But as we discussed, our diet has to have more protein, because what we do in India is basically जब हम एक रोटी खाते हैं उसके साथ तीन चार रोटी के साथ एक कटोरी दाल खाते हैं. इट शुड बी द अदर वे अराउंड एक्चुअली, कि अगर हम एक रोटी खा रहे हैं उसके साथ 3 कटोरी दाल होनी चाहिए. That what it indirectly means is that your diet has to be rich in protein. We get very less protein, and in India we have very uh, quite typical subset that people have. They don't have very muscular arms or shoulders, but they have fat around their belly. So that has been actually the problem with our genes, probably because we have had in the past, like you used to have famines and they used to store your fat during the times when you used to have a lot of uh, when there was the food was present in plenty. So that is why the storage used to take place. So now that in our diet, what I tell my patients is that half of your plate, your calorie intake should be less, but the type or amount of diet that you should have, half of your plate should be of proteins. If you're a non-vegetarian, it should contain fish and chicken and eggs, no red meat, which and the fish and chicken should also be grilled or boiled. It should not have a lot of oil floating over it. And 1/4 should be carbohydrates in the form of roti, chapati, chawal, or pasta, whatever. And then the last 1/3, 1/4 actually, should have fruits, vegetables, and other things. So the maximum emphasis is on proteins in the diet, which our country lacks to a lot of extent. So though there has to be a shift in our diet for us to live healthy, and not lose our muscle mass, and also side by side exercise, because it is not only the diet but also the exercise which is important in maintaining our muscle mass, which is our only guarantee for a prolonged healthy life, and to ward off any kind of complication, not only liver but other complications also that can happen with age.
Yes. So guys, add protein into your diet, and that should be healthy, and some exercise, as sir has already suggested. So, sir, thank you so much for these wonderful insights that you have given. So, on behalf of Nash 24/7, I thank Dr. Rajeev for this lively and informative talk. As you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regular make their visit to the doctors and continue medication. With careful observation and precautions, it is possible to obtain control on the disease. I would like to thank our audience for their active participation and patience in making this event successful. Stay connected with Nash 24/7 on Facebook and take care of yourself and your family members. Thank you. Thank you, sir.